Have you ever thought your legs could tell a story about your heart health? It sounds a bit strange, right? But it's true. Your legs might be sending you subtle or not so subtle signals about your cholesterol levels. Today, we're going to dive deep into a condition that is often overlooked but incredibly important: peripheral artery disease, or PAD. We'll explore what it is, how it's linked to high cholesterol, and what specific signs you should be looking for in your own legs. This isn't about scaring you. It's about empowering you with knowledge, because when you know what to look for, you can take action early and protect your health. So grab a seat, get comfortable, and let's talk about what your legs might be trying to tell you. First, let's break down the main culprit: high cholesterol. You've probably heard the term a million times, but what does it actually mean? Cholesterol itself isn't a villain. It's a waxy substance your body needs to build healthy cells. The problem starts when you have too much of the bad kind, known as LDL cholesterol. Imagine LDL cholesterol as tiny, sticky particles floating through your bloodstream. When there are too many of them, they start to stick to the walls of your arteries, which are the highways that carry blood from your heart to the rest of your body. Over time, these sticky deposits, along with other substances like fat and calcium, build up and form something called plaque. This process is called atherosclerosis, which basically means hardening of the arteries. Think of it like a pipe getting clogged with gunk over the years. The opening gets narrower, making it harder for water, or in this case, blood, to flow through. Now, where do your legs come into this? Well, these arteries don't just go to your heart and brain. They supply blood to your entire body, including your arms and legs. When plaque builds up in the arteries that supply blood to your limbs, it's called Peripheral Artery Disease, or PAD. Your legs are the most common place for PAD to occur. The narrowed arteries mean less oxygen-rich blood can get to the muscles and tissues in your legs. And that's when the symptoms start to appear. It's your body's way of waving a red flag, telling you that your circulation is struggling. Recognizing these signs is crucial because PAD isn't just about leg pain. It's a major red flag for your overall cardiovascular health. If you have plaque in your leg arteries, there is a very high chance you have it in the arteries leading to your heart and brain as well, putting you at a much higher risk for a heart attack or stroke. That's why we need to pay close attention to our legs. So, what are the specific signs you should be looking for? The most classic symptom of PAD is something called claudication. That's a fancy word for muscle pain or cramping that happens when you're active, like when you're walking or climbing stairs, and then it goes away after a few minutes of rest. The pain can be in your calves, thighs, or even your buttocks. Why does this happen? When you're active, your leg muscles need more oxygen. But because of the narrowed arteries, your legs just aren't getting the blood supply they need to meet that demand. It's like trying to run a marathon after only eating a single cracker. Your muscles are essentially starving for oxygen, and that starvation causes pain. Once you stop and rest, the muscles' demand for oxygen decreases and the pain subsides. If you notice this pattern of pain with activity that goes away with rest, it's a huge sign that you should talk to your doctor. But claudication isn't the only symptom. As PAD gets worse, the signs can become more constant. You might feel leg numbness or weakness. Your legs might feel heavy, as if you're dragging weights around. Another really telling sign is a change in the skin on your legs. You might notice that your legs feel cool to the touch, especially compared to your arms. This is because there's less warm blood flowing down there. The skin might also look pale or even have a bluish tint. It can become shiny and thin. Because of the poor circulation, you might also experience hair loss on your legs and feet. The hair follicles just don't get enough nutrients to grow properly, and your toenails might start to grow more slowly or become thick and brittle. These might seem like small cosmetic issues, but they're actually important clues about your circulatory health. As PAD progresses, the symptoms can become even more serious. You might start to feel pain even when you're at rest, especially at night when you're lying down. This is called rest pain, and it often happens in the toes or the front of the foot. Propping your foot up can make it worse, while dangling it over the side of the bed might offer some temporary relief, because gravity helps pull a little more blood down into the foot. Another very serious sign is sores or ulcers on your toes, feet, or legs that don't heal or heal very slowly. When you have poor blood flow, your body can't deliver the necessary cells and nutrients to heal injuries. So even a small cut or blister can turn into a dangerous, non-healing wound. If you notice a sore that just won't go away, it is absolutely essential to see a doctor immediately. This is a sign of advanced PAD and needs urgent medical attention to prevent serious complications. So, who is at risk for developing high cholesterol and PAD? There are several factors. Some are out of your control, like age. The risk increases as you get older. Family history also plays a big role. If your parents or siblings had high cholesterol or heart disease at a young age, your risk is higher. But there are many risk factors that you absolutely can't control. Smoking is one of the biggest. It damages the lining of your arteries, making it easier for plaque to build up. Having high blood pressure or diabetes also significantly increases your risk, as these conditions also contribute to artery damage. And of course, lifestyle choices matter a lot. A diet high in saturated and trans fats found in many processed foods, red meat, and full-fat dairy can raise your LDL cholesterol. A lack of physical activity and being overweight also contribute to higher cholesterol levels and overall poor cardiovascular health. The good news is that there is so much you can do to manage your cholesterol and either prevent or treat PAD. It all starts with a visit to your doctor. A simple blood test can measure your cholesterol levels. If you're experiencing any of the leg symptoms we've talked about, your doctor might also perform a simple painless test called an ankle brachial index, or ABI. This test compares the blood pressure in your ankle to the blood pressure in your arm. A low ABI score can indicate that you have PAD. Once you have a diagnosis, your doctor will work with you on a treatment plan. This almost always starts with lifestyle changes. Adopting a heart-healthy diet is key. This means focusing on fruits, vegetables, whole grains, lean proteins like fish and chicken, and healthy fats from sources like avocados, nuts, and olive oil. Cutting back on processed foods, sugary drinks, and unhealthy fats can make a huge difference. Regular physical activity is another cornerstone of treatment. I know it sounds counterintuitive to exercise when it causes leg pain, but it's one of the best things you can do. Your doctor might recommend a supervised exercise program. The idea is to walk until the pain starts, rest until it goes away, and then walk again. Over time, this process helps your body build new, smaller blood vessels that can bypass the blockages, a process called colloidal circulation. It's like your body building its own natural detours. This can significantly improve your walking distance and reduce your pain. And of course, if you smoke, quitting is the single most important step you can take for your health. Quitting smoking can halt the progression of PAD and dramatically lower your risk of heart attack and stroke. In addition to lifestyle changes, your doctor might also prescribe medication. Statins are a common class of drugs used to lower LDL cholesterol. They are very effective at reducing plaque buildup and lowering your cardiovascular risk. Your doctor might also prescribe medications to lower your blood pressure, manage your blood sugar if you have diabetes, or prevent blood clots from forming. In more severe cases of PAD, where the blockages are significant and causing severe symptoms, a medical procedure might be necessary. This could involve an angioplasty, where a small balloon is used to open up the narrowed artery, often with a stent placed to keep it open. In other cases, bypass surgery might be needed to reroute blood flow around the blocked artery. But the goal is always to start with the least invasive treatments first, which are lifestyle changes and medication. So, let's recap the key takeaways. High cholesterol leads to plaque buildup in your arteries, a condition called atherosclerosis. When this happens in the arteries of your legs, it's called Peripheral Artery Disease, or PAD. The signs of PAD in your legs include cramping pain when you walk that goes away with rest, leg numbness or weakness, cool or shiny skin, hair loss on your legs, and slow healing sores. These symptoms aren't just a leg problem. They are a warning sign for your entire cardiovascular system. If you notice any of these signs, please don't ignore them. Don't just write it off as a normal part of getting older. Talk to your doctor. Getting an early diagnosis and starting treatment can help you manage your symptoms, improve your quality of life, and most importantly, significantly reduce your risk of a heart attack or stroke. Your legs really can tell a story about your heart health. It's up to us to listen to what they're saying. Thank you so much for joining me today to learn about this important topic. I hope this information empowers you to take proactive steps for your health. If you found this video helpful, please give it a thumbs up and consider subscribing to the channel for more health content. Don't forget to share it with friends and family who might benefit from this knowledge. Your health is your greatest asset. Take care of it. See you in the next video.